Today we will be seeing about the electric pulp test. So the electric pulp test is one of the tests used to determine the pulp vitality. So the main objective of this test is to determine whether the tooth is vital or non-vital based on the electric current signals sent to the tooth. So the objective is to stimulate a pulpal response by subjecting the tooth to increasing degree of electric current. Overview of pulp vitality. The pulp vitality test attempt to examine the presence of the pulpal blood flow and to decide whether the pulp is vital, which means it has a healthy blood flow, or if the tissues of the pulp are necrosed or dead. Pulp vitality is essential for maintaining tooth function and oral health. Accurate assessment of pulp vitality informs treatment decisions and improves patients' outcomes. So let's move on to the how EPT is performed. The objective is to stimulate a pulpal response, as we said before. So a positive response is indication of vitality, and a negative response is determining abnormality of the pulp. No response to the electric stimulus can be indication of necrosis. So the procedure follows as: first, explain the test to be performed to the patient in detail. Isolate the area of the control and the tooth to be tested. Check the electric pulp tester for function and determine the current is passing through the electrode. The test is always performed on the control tooth prior to the test tooth. Apply an electrolyte on the tooth electrode and place it against the dried enamel of the crown's occlusobuccal or incisobuccal surface. It is important to avoid contact with any of the restorations of the tooth or adjacent soft tissues. So the placement of the tester is critical to ensure accurate response from the tooth. For the anterior teeth, it is placed in the incisive third, and for the posterior teeth, it is placed in the mid third or the mesiobuccal cusp of the molars and buccal cusp of the premolars. So the completion of the circuit is done by retracting the patient's cheek away from the tooth electrode, and the electric circuit is completed either by a ground wire, which is also called as the lip clip, which is placed on the patient's lip, or the clinician instructs the patient to rest the finger on the metal sheet of the pulp tester, or turning the rheostat slowly to introduce the minimal current into the tooth and increase the current slowly. So interpretation of the results. So the first result may be the normal response, that is a positive response that occurs at the same neural excitation threshold as the control tooth. For example, during the assessment of the maxillary left lateral incisor, the control tooth would be the maxillary right lateral incisor. The test tooth would be considered normal and vital if both the teeth exhibit a positive response at a similar numerical value. And the second is the negative response. This denotes a non-vital tooth which fails to respond even when the tester is set to the highest electric excitation value. So the advantages of the electric pulp testing is it is non-invasive and relatively simple procedure. Quick assessment of the pulp vitality can be done and helps in treatment planning and prognosis. Thank you very much.